Hi, I'm Matthew Noble, one of the shoulder and elbow specialists at Crystal Clinic Orthopedic Center, and I'm here to talk about our normal postoperative care. The first thing we're going to talk about is different slings you may see after surgery. So this is an example of a simple sling. She has it at the appropriate position. Her thumb is just around her belly button, kind of midline, and it's sitting with her arm about parallel to the floor. This arm positioning will be the same whether or not you're in a simple sling like this one or in an abduction sling. Now this simple sling you're going to see after normal procedures like a liceable adhesion or even a straight decompression, biceps tenodesis, things where we're going to encourage you to be moving right away and we're not necessarily protecting a certain repair like a rotator cuff or even a total shoulder arthroplasty. This is an example of an abduction sling. So it's very similar to the simple sling, but it's keeping her arm nice and away from the body, protecting that repair that we just did. Now you can see her arm is still parallel with the floor, and her thumb is still about midline in the body in line with that belly button. The sling, just like previous, the strap comes around the shoulder, and then she has one coming around her waist. The DME specialist will fit you for either this one or a different one. Now, depending on the type of surgery you have, you may be in a sling for some period of time, sometimes 4 to 6 weeks. Even with that though, it is okay to come out of your sling, and I want you to do certain exercises like your hand, wrist, and elbow. If you're sitting watching TV and you need a break from that sling, you can sit just like she is. She's sitting nice and comfortable with her arm out away from her body, just like that pillow was intact right here. And it's slightly abducted, and she's not letting that elbow slouch down, okay? Now when you're done relaxing, or you're done with your exercises, you can put your sling back on yourself, and she's gonna demonstrate that for you. So the first thing she's gonna do is she's gonna grab her sling, she's gonna place it on her lap, and the key to this is what you're gonna notice is she's not gonna use her operative arm, okay? She's really letting that thing relax. So she's gonna bring that into her sling. She's gonna first grab that strap that goes around her waist, and she's gonna buckle it into the pillow. She's then gonna grab the strap that goes over her shoulder, bring it to the front just slightly so she can get control of it, and then bring it over to place it into place. You can notice she's not rushing, she's taking her time, she's really letting that arm relax like I said earlier, because again, we really want to protect that repair early on. So this is the time to focus on details. So this is that second abduction sling that I talked about earlier in this video. It's very similar to the first abduction sling that you saw, except how the strap that comes over your shoulder fits. So instead of resting on top like a normal sling that you've seen before, this one has this little loop. It's very much like an archery strap or a backpack strap that you're gonna put your non-operative arm through, okay? So when you're done with your exercises, she's gonna grab her sling and she's gonna place it into her lap, and then she's gonna position her straps so they're just how she knows where they are and she can find them, okay? After she knows where her straps are, she's gonna buckle her pillow strap first. Again, very similar to the first one. She's gonna position that other strap for herself, and she's gonna slip her arm into her sling now. So again, she's letting it hang. She's not using that shoulder, because again, we want to protect that repair, okay? And then she slips that on just like a backpack, and she buckles them in here. This is a good view too of how this sling is just slightly different than that other one. You see how that other sling is just over top that shoulder. You've seen these in movies or in the past, especially when you're a kid. But this one, it kind of fits nicely around that shoulder. All right, so here's an example of a dressing that you'll see after an arthroscopic procedure like a rotator cuff repair. It's gonna be a big bulky dressing with lots of tape. Now don't be concerned if you see a little bit of discoloration or a little bit of drainage shortly after surgery, because we do use a lot of water during the procedure, and sometimes this seeps out just slightly. That's normal. This dressing will change 2 days after surgery, and on the 3rd day I'll allow you to actually shower too, okay? So what you do in order to change this is you remove the tape gently, because again, you may be a little swollen, especially if you know you have thin skin. Just make sure you have a nice firm grasp on that as you take this tape off or have somebody help you. So as this comes off, you're gonna see what we call an ABD, and then you have some 4x4s underneath, and then you're gonna see this kind of mesh-like dressing. It's called a daptic. So then this adaptic will just come right off, and you'll see 3 or 4 small little poke holes from surgery. And what that is you'll see a little bit of glue over top. Don't peel the glue off, that will just normally fall off over about 5 to 7 days or so, and this is going to help seal things off. After your dressing comes off, I just want you to cover those incision sites with a Band-Aid. No need to put any ointments or anything like that over the incisions. These Band-Aids will kind of keep it nice and clean. It will also keep any suture that's all underneath the skin, but it'll keep anything from catching on your clothes. After you shower, again, starting on that 3rd day, just replace these Band-Aids, and you'll do that for about the first week or so. Make sure that you're not having any increasing drainage after that week, and as long as it's nice and dry, no need for any more Band-Aids. So what you see here is a dressing that you may see after an open case. That's anatomic total shoulder arthroplasty, or reverse total shoulder arthroplasty, or some of our open fracture care cases. What you see here is you have a piece of white gauze, and over top is a piece of plastic. It's a waterproof dressing. You'll remove this 2 days after surgery, and again, I'll let you start showering on day 3. So when we change this dressing, we remove this plastic piece. It kind of peels off nicely. You'll see a mesh dressing. That's going to stay in place, okay? I'm going to see you about a week or so after surgery, and at that time I'll take a look and we'll remove it then. After you remove the overall dressing, you'll take an island dressing. We're going to provide you with some extra ones of these, and this will just go over top. And this is a waterproof dressing that just nicely covers it. Underneath that mesh, I didn't talk about that, but you'll see that there is glue, just like we saw in that arthroscopic cases, and that's going to keep water or bacteria out of the incision site, but still try not to touch the incision while you're changing the dressing, okay? These will be provided with you, and we'll keep changing it for about 7 days or so after surgery before we start letting it open to air.